Morning, everybody. I wanted to talk about something that's came out in the news recently. Allergan, which is one of the biggest implant companies, just removed their textured implants from the market, did a recall of those implants. That was voluntary, but it was suggested to them by the FDA that they do that. What that means, the recall on these implants, is for any implants that are currently in a surgery center or hospital or in a doctor's office that are being unused. Those have been recalled by the company. It doesn't mean that if you have textured implants that it's a recall on those that are already implanted. The reason for this recall was that there's a type of lymphoma that's very rare, but has been associated with textured breast implants, and it happens around the implant in the capsule. This is different than a breast cancer. It's not breast cancer, rather it's a rare lymphoma, and the rates of it happening are changing over time as the FDA does more research into this. It does appear to be only associated with textured breast implants. Doesn't appear to matter whether you had a saline or a silicone implant. It's more what's on the surface of the implant. Is it textured or smooth? If you're one of my patients, you don't have a textured implant. I've never used those. It's not because I knew this was going to happen or any other important reason. It's just that I don't necessarily like the way the textured implants feel. The texturing of the surface of the implant causes the implant to stick to your tissue, including to your chest wall, which means that the implant doesn't move like your normal breast would. That's why I've always liked the smooth, round implants, because when your arm comes across it, it moves just like your breast would, whereas a textured implant is typically going to feel more firm and more unnatural. The reasons for using textured implants have been things like lower risk of getting capsular contracture and certain anatomical shapes that someone's trying to achieve, and then they've been used a little bit more in breast reconstruction than in cosmetic surgery. So if you do have a textured breast implant, or you're just curious what type of implant you have, that's something you can talk with your surgeon about. The FDA is currently not recommending that those who have textured breast implants go and get those removed, but that is a conversation you can have with your surgeon. And you do certainly need to know about monitoring protocols for your breast implants, whether you have textured or smooth round implants. And so that is the current event that happened, just so that you're aware of it. If you have any more other questions about your type of implant or anything like that, just speak with your surgeon, and I'm sure he or she will be able to have a good conversation with you about that. All right, hope everybody has a good day.